Myself, Dr. Ujjwal Roy, consultant neurologist at Ranchi, Jharkhand. Stroke is a leading cause of morbidity and mortality worldwide. And as we all know that identification of stroke at the correct time and identification of the presenting features is the most important, because stroke needs to be treated as soon as possible, because in stroke we lose millions and millions of neurons every second. So we need to identify these symptoms as soon as possible so that we can give some injections to the treatment and further some other therapies which are needed to be given in a particular time frame. Especially in ischemic stroke, where we can open the vessel by thrombolizing the patient, and also sometimes thrombectomy, in which we lyse the clot by use of some instruments and some wires. Also important is the rehabilitation part, where the patient has some disability after the stroke. As we all know that patient has a quite severe disability sometimes after the stroke happens, and in these stroke survivors, neurorehabilitation is a very important tool to bring back the patient to the normal life. In that rehabilitation, what is important is the role of physiotherapists, physical medicine specialists, neurologists, and also the caregivers, the society, pain therapists, and other people. What is important here is that sometimes this treatment is frustrating, and people tend to go to the people like quacks and centers like Lakwa Kendra, things like that. And there the treatment actually deteriorates and patient actually has a re-stroke. So what is important that you remain in the treatment of a qualified neurologist or neurosurgeon, whatever, and with the help of the team of the neurologists, rehabilitation specialists, physiotherapists, and other people like speech therapists, cognitive therapists, the treatment goes on a single line, because once the patient has a stroke, patient has a chance of recurrence of a stroke. So in that case, this kind of holistic therapy helps. Other thing is that in prevention, as we all know, the role of dietary therapy, a good diet, nutritious diet, and along with that exercise is also very important, and identification of risk factors like diabetes, hypertension, and managing those risk factors. So overall, what is important is that once you have a stroke, you should immediately rush to a setup where this team is available, and then you should also remain in treatment. You should be compliant to the treatment, because once you are, if you leave that treatment, then what happens? You actually deteriorate sometimes due to wrong therapies, due to wrong practices, and that is what is most important.